All right, let's get right into it. If you're an expectant parent or know someone who is, you've probably heard of non-invasive prenatal testing, or NIPT. It really burst onto the scene as this revolutionary technology, promising incredible peace of mind from just a simple blood test.
I mean, it sounds almost too good to be true, doesn't it? A safe, easy way to get a checkup on your baby's health. But, as we're about to find out, simple on the surface can get, well, pretty complicated underneath.
So, to really get why NIPT was such a massive game changer, you have to look at what parents were dealing with before. The options on the table were tough. They often involved some really difficult choices and some very real risks.
And this right here shows you the huge leap forward. On one side, you had invasive tests like amniocentesis. I mean, they were effective, sure, but they came with this small but absolutely terrifying risk of causing a pregnancy loss. Then, suddenly you have NIPT, a simple blood draw from the mother's arm. No direct physical risk to the baby. You can see the appeal right away. It's just so clear.
Okay, so how in the world does this work? How can a little bit of blood from mom tell you so much about the baby? Well, the secret, believe it or not, is floating around in the bloodstream itself.
It all comes down to something called cell-free DNA, or cfDNA for short. We all have these tiny little bits of genetic material just floating in our blood. But during pregnancy, something amazing happens. The placenta actually sheds its own DNA into the mother's bloodstream. And that placental DNA is, for all intents and purposes, a genetic blueprint of the fetus.
Now, here's what's truly mind-blowing. Just look at that number. We are talking about a tiny, tiny fraction. Out of all the cell-free DNA in the mom's blood, only about 3 to 6% of it actually comes from the placenta. It is literally like finding a needle in a haystack. And yet, our modern tech is so powerful it can pick it out and analyze it. It's just incredible.
And by analyzing that tiny little signal, NIPT can screen for the most common chromosomal conditions. You know, things like Down syndrome, which is trisomy 21, and others like trisomies 18 and 13. And that is the amazing promise of this test. Early, safe, and super accurate screening.
But this is where the story takes a sharp turn. Because as powerful as the test is, the biology it's looking at is incredibly complex. And the results you get back are not always the simple yes or no that everyone is hoping for.
It turns out there are a whole bunch of reasons a result can be misleading. You've got things like a vanishing twin, the mother's own health issues, or maybe there just wasn't enough fetal DNA in the sample to begin with. But the most common culprit for a false positive is this thing called confined placental mosaicism.
And this right here is probably the most important thing to understand. Remember how the NIPT is analyzing DNA from the placenta? Well, sometimes a genetic issue can exist only in the placenta and not actually in the baby. So the baby could be totally healthy, but the placental DNA sets off an alarm. That's confined placental mosaicism. It's a huge reason for those confusing results. You know, a really good way to think about this is that NIPT is not a diagnosis. It's more like a super advanced weather forecast. It can tell you there's a 99% chance of rain, but it can't tell you with absolute 100% certainty that it is raining right now.
And hey, don't just take my word for it. The scientific community is crystal clear on this. This quote says it all. NIPT is a screening test. It gives you probabilities, not certainties. A high-risk result isn't the end of the story. It's a signal that says, hey, we should probably look closer, which might mean doing a diagnostic test like an amnio to get a final answer. So just when you think you've wrapped your head around all that complexity, there's another twist. A layer of nuance that, honestly, almost nobody sees coming. It turns out the test isn't just looking at the baby. It can sometimes find hidden information about the mother's health, too.
So let's go back to that blood sample for a second. It's got that mix of cell-free DNA, right? Some from the placenta and some from the mother. The technology is designed to focus in on the placental stuff.
But what happens when the mother's own DNA is the thing that's sending up a red flag? What if the test stumbles upon something totally unrelated to the pregnancy?
And this is where things get really intense. In very rare cases, a strange or unusual NIPT result that just doesn't add up can actually be an early warning sign of a hidden cancer in the mother. Why? Because tumors can also shed their own unique cfDNA into the bloodstream. Just imagine getting that news. It opens up this huge, complex box of medical and ethical questions for both parents and their doctors.
So with all this going on, we're talking false positives, results that are just probabilities, and these potentially life-changing incidental findings. How can anyone possibly navigate it all? Well, the answer isn't necessarily more advanced technology.
It's better conversations. It's better communication. And the way forward is actually pretty direct. If a result hints at a potential cancer in the mother, you need extensive, careful counseling. If a rare issue is flagged that's likely just in the placenta, the next logical step is a confirmatory test. And for all the other complex stuff, you absolutely need an expert to help guide the conversation.
See, this can't be just a single, quick chat. It has to be a process, and it has to be handled with incredible care. It should start before the test is even done, to manage expectations and talk through what might happen. Then it has to continue after the results come in, with genetic experts who can really explain all the nuances. Because the whole point, the ultimate goal, is to empower parents so they have the clarity and the support to make the best decisions for their family.
And you know what's really great? The research that's pushing this conversation forward is open access. It's available for anyone to read and learn from, all thanks to a Creative Commons license. When you step back and look at the whole picture, NIPT is an amazing piece of human ingenuity. It's a brilliant tool that's really changed prenatal care. But its story is also this powerful reminder that the more data we get, the more complex things can become. So as our technology gets smarter and smarter, maybe the most important question we need to ask ourselves is this one. How do we get better at the very human conversations that have to follow?